Thank you for tuning in and checking out my presentation. I am Markevis Watson, a student physical therapist assistant studying at Delaware Technical Community College. Today I'll be doing my presentation on the pathology rheumatoid arthritis, or RA. I'll be discussing what RA is, how it impacts individuals from day to day, how the participants cope with it, and lastly, relating RA to physical therapy. Now, before I get into the meat of my subject, I will share the method of research that was done in the medical journal that I'll be referring to. There are a total of 32 participants who were recruited from outpatient clinics at 2 Danish hospitals, with clinical staff selecting purposeful sampling criteria that spans the greatest possible variation in gender, age, disease duration, and educational background. There are a total of 6 groups. Half of the groups are participants who were recently diagnosed with RA within a year and a half or less, and the other 3 groups have been diagnosed with RA for greater than a year and a half. In my opinion, the strength of the research was solid. I really like the in-depth descriptions and the personal interviews that the authors conducted and the verbatim comments from the patients that were included. The authors did an awesome job describing how RA affects individuals from day to day, physically and mentally. However, the research doesn't have an ample sample size. For that reason, further detailed investigation is needed. RA is a chronic, fluctuating, or progressive autoimmune disease. It is the leading cause of physical disability worldwide. The disease is associated with pain, stiffness and joint damage, and fatigue. RA leads to disability, substantial functional loss, and shortens life expectancy. In the study, it showed that RA affected almost every facet of the participants' daily lifestyles. It took an enormous physical toll on their bodies. They described how the symptoms of joint stiffness, pain, and fatigue limited their physical capacity. Some participants described how they had to adjust and create new routines to compensate or try to make up for their deficiencies. They described the process as a fight between mind and body. The physicality is debilitating, but I believe the mental impact could be greater. The participants delineated how RA affected their self-perception and identity. Most of their initial reactions were described as being a disruption to their lives, with reactions ranging from feelings of hope to feelings of incompetence, and in some cases, depression. RA had affected most of their social relationships with friends and family. Friends have withdrawn or placed a stigma upon them. Participants who once were independent have to rely on spouses or children to take on an extra load in caregiving. The participants with infants and children are unable to play and interact with their children in numerous activities. Furthermore, work was of central importance because it is something you do every day. The participants described work as being important to their identity and self-esteem, and the loss of work could result to a loss of orientation in life, feelings of powerlessness, and the fear of not being able to adequately support their family. These are just several examples of the many psychological and mental challenges that they are faced with. Through the rapid, life-changing events that RA has caused, many participants felt the need to meet others with RA, especially many recently diagnosed participants. It gives them a calm assurance and relief that they are not alone, that there are others who are going through similar complications. Moreover, they are encouraged to see that it is possible to maintain a close to normal lifestyle. Physical therapy has an important role in managing and treating patients with rheumatoid arthritis. The aim is to reduce or prevent atrophy and deformity, alleviate pain, and increase functional capacity. Each treatment plan is dependent upon a physical assessment for each patient, which includes a functional assessment, range of motion test for all of the joints, muscle strength test, postural assessment, and an evaluation of respiratory function. In order for the plan to be effective, patient education is vital. As physical therapists and physical therapist assistants, our role is to inform the patient and help them understand that due to their condition, we will have to modify the way they live to reduce or prevent symptoms and overall functional loss. By explicitly informing the patients, that will increase their compliance, which in turn will increase their function. Also, informing the family is very important so that they will be able to properly support their loved one. Furthermore, modalities are commonly used in the treatment of RA. Cold and heat packs, electrical stimulation, and hydrotherapy are used to relieve pain and increase comfort. Also, massage therapy is commonly used. It can help diminish swelling or inflamed joints. Massage is found to be effective on depression, pain, and anxiety, and it decreases stress hormone levels. In addition, joint protection strategies such as assistive devices, splitting, orthosis, and compressive gloves are beneficial in patients with RA by preventing deformities, decreasing pain, inflammation, and joint stiffness. Lastly, and extremely importantly, therapeutic exercise is key to the treatment plan. Active exercises stimulates circulation, promotes flexibility, and reduces or prevents atrophy, deformities, and contractures. Some recommended exercises are stretching, aerobic conditioning, range of motion, and strengthening exercises. All in all, rheumatoid arthritis is the leading cause of physical disability worldwide. Today we have discussed what RA is, how it impacts individuals from day to day, how the participants cope with it, and lastly, the intervention of physical therapy on rheumatoid arthritis. Once again, I want to thank you for tuning in. I hope you have enjoyed my presentation. If you have any questions or comments, I encourage you to email me. Thank you very much.